I'd like to start off with a quote by J.K. Rowling that depicts depression well. Depression is the most unpleasant thing I have ever experienced. It is that absence of being able to envisage that you will ever be cheerful again, the absence of hope, that very deadened feeling which is so different from feeling sad. Sad hurts, but it's a healthy feeling. It is a necessary thing to feel. Depression is very different. So, what is depression, and how is it different from sadness? Depression is a mental illness characterized by a prolonged feeling of sadness, while sadness is a normal human emotion. They are different because sadness can usually be traced back to a specific event or reason, but with depression, there is no real trigger needed. A person can have every reason to be happy, but still be depressed. When feeling sad, you can usually still be excited about the things you enjoy, while with depression, you can lose interest in what you used to love. There are specific ways to differentiate between the two for a diagnosis of depression, which I'll get into later. So, how does depression affect kids and adults in the US? Depression affects about 1 in 15 adults, 6.7% every year. This is about 16 million Americans. 1 out of every 6 adults will have depression at some time in their life. Depression can occur at any time, but on average, it first appears during the late teens to mid 20s. Women are more likely than men to experience depression. 3.2% of children aged 3 to 17 years, approximately 1.9 million, have been diagnosed with depression. For kids, diagnoses of depression are more common with increased age, so it is most common for kids 12 to 17 years old. Less than 50% of kids and adults with depression receive treatment. People with depression are also more susceptible to developing certain diseases, dropping out of school, or having a substance use issue compared to their peers. For kids or adults, depression affects their mood and quality of life, as some common symptoms can affect things like concentration, sleep, eating habits, libido, and irritability. So, what are the symptoms? Simply put, a quote by Atticus reads, "Depression is being colorblind and constantly told how colorful the world is." To be more specific, the DSM-5 has outlined a few criteria for diagnosing depression. Their guidelines say that the individual must be experiencing 5 or more symptoms during the same 2-week period, and at least one of the symptoms should be either depressed mood or markedly diminished interest or pleasure in all or almost all activities. Others include significant weight loss or weight gain when not dieting, or a decrease or increase in appetite, a slowing down of thought and a reduction of physical movement, or fatigue or loss of energy nearly every day. Although the causes of depression are not exactly known, research has shown it could come from a combination of genetic, biological, environmental, and psychological factors. A few factors that may increase the likelihood of depression are having a blood relative who has had depression, experiencing a traumatic or stressful event such as the loss of a home or the death of a loved one, the weather, and this is called seasonal affect disorder, being diagnosed with a medical problem such as cancer, taking certain medications, or using alcohol or drugs. Although there is no cure for depression, treatment can help reduce the length of depression or reduce symptoms. The first form of treatment is therapy, which mostly focuses on your thoughts, feelings, and past or current experiences that may be worsening your symptoms and helps you find ways to cope. A second form of treatment is medication. These are called antidepressants, which can help increase serotonin levels and help lessen the severity of symptoms to improve your mood. So, where does exercise come into play? One quote that I love reads, "Exercise is the most potent and underutilized antidepressant, and it's free." Research has also shown that exercise can ease symptoms of depression by releasing feel-good endorphins, natural cannabis-like brain chemicals that enhance mood. It can also raise serotonin levels in your brain to boost your mood and overall sense of well-being. It can also help improve appetite and sleep cycles, which, as we've discussed, can be symptoms of depression. It can increase self-esteem and self-confidence, as well as take your mind off of worries so that you can get away from the cycle of negative thoughts and cope in a healthy way. A few studies have looked at the effect of exercise on depression symptoms. First, in a 12-week trial, 18 to 70 years old people with major depressive disorder were divided into 2 groups, a high dose of exercise that met daily recommended criteria and a low dose group. The researchers used a questionnaire to assess the results of the study. They found that exercise does improve physical energy, mental energy, and social motivation for both groups, but the results were statistically significant in the recommended dose group. This shows that exercise is very beneficial when we follow the recommended amount. In the second study, 15, 20 to 39, and 60 to 79-year-olds total with major depressive disorder participated in a 12-week trial. They were divided into two groups. The first group was given an antidepressant, and the second group was given an antidepressant and participated in exercise. Both groups saw a reduction in symptoms. Although both groups saw an improvement, the exercise group had a more efficient trajectory of decline in symptoms compared to the group with only an antidepressant. These results show that exercise is not only beneficial, but that it can also improve symptoms when taken with medication. In the last study, 59 people with mild to moderate symptoms were split into three groups: a behavioral activation group, a physical activity group, and a control. The results showed that symptoms significantly reduced in the physical activity and the behavioral activation group compared to the control. But overall, the physical activity intervention compared to the behavioral activity group had significantly greater reductions in depression severity compared to the controlled condition. This suggests that both can improve symptoms, but physical activity may prove to be more beneficial. For my personal connection, I have been diagnosed with depression and anxiety, so this topic is near to my heart. I understand firsthand the symptoms of depression and what treatment and coping with symptoms is like. I am also a kin major, so I am passionate about physical activity to improve my mind just as much, if not more, than my body. And personally, I have found that physical activity usually improves my mood and concentration, so I'm glad I could bring awareness to this topic and maybe even help others with depression too. Thank you.